What's up, everyone? This is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. Today, I have a very special guest who's going to tell us all about the field of bariatric surgery, why he went into it, and also some tips for you guys. Dr. Thompson, what's up, man? How you doing?
How you doing, Dr. Webb? How's it going?
Good, good. Tell the viewers out there who you are and kind of what you do.
Okay, so I am Dr. Charles Thompson III. I am a general and bariatric surgeon, minimally invasive surgeon. About 50% of my practice is bariatric or weight loss surgery, and the other 50% is general surgery. So gallbladders, appendices, colons, other stomach operations, hernias, that's all included in general surgery.
Got you. Thinking kind of back to medical school and then trying to pick a specialty, what was it about general surgery that got you interested in it? Why did you choose general surgery?
Well, really quickly, my third year of medical school, we did all our rotations. Mm-hmm. And I did almost every single rotation other than surgery before surgery.
Gotcha.
As I was going through those rotations, at the end of each rotation, I said, oh yeah, I definitely want to be a pediatrician. Oh yeah, I definitely want to be a psychiatrist. When I got to surgery, it was a different field. Yeah. At the end of that rotation, I said, oh, I have to be a surgeon. And of course, helping people, all these things combined is what surgery offered me. And so there was no other decision to be made. Surgery was it.
Yeah, that's exactly how I came upon surgery as well. I loved every rotation I was on, and then I just fell in love with surgery.
That's right.
One of those things that you either don't like surgery or you do. So there's really no...
Very true. Very true.
Yeah. And then you did your general surgery residency. How long is the training for that?
So residency is 5 years. You do have the option. Most programs have the option of taking time off in the middle of the residency to do 1 or 2 years of research, medical research. I chose not to do that. I had done plenty of research in the past and wanted to complete the residency.
Got you. So you did your 5 years, and then it was time to, or I guess before your training was up, apply for a fellowship. What was it about bariatrics? Why did you choose to do a fellowship in that?
So unlike primary care physicians, surgeons aren't able to follow their patients, meaning if somebody comes in with a gallbladder problem, I take out their gallbladder, I see them for one post-operative visit, and then I don't see them again.
Gotcha.
Bariatric surgery, however, is completely different. You get to know your patients. You get to follow them both before the operation and after the operation. So for example, in bariatric surgery, you follow your patient. You see your patient in the office 1 week after surgery, 1 month after surgery, 3 months, 6 months, and then annually. And so during that time, as many times as we see them, you get to see the effect that your procedure had on their health and on their life overall. I've had patients who come in who have a completely different outlook on life because they're healthier, because they're more social. It's just completely life-changing. So general surgery is amazing, but bariatric surgery allows me to follow patients and get to know my patients a little better.
Gotcha. And for the people out there that don't know what bariatric surgery is, can you kind of break it down? What is bariatric surgery?
Sure. So bariatric surgery, in the medical business, we say bariatric, but it's a lot of people don't know that word. Bariatric surgery is weight loss surgery, which is completely different than liposuction or cool sculpting. A lot of patients and people who are not familiar with this type of surgery think that weight loss surgery is about cosmesis and about aesthetics. It is 100% not about cosmesis and aesthetics. We do certain procedures that rearrange your stomach and your intestines to help you lose a significant amount of weight. Not only that, you have other medical conditions that go along with being overweight, like diabetes or hypertension. And most of the time, these diseases are cured. If not, they're treated very well. So for example, patients who are on insulin and 3 or 4 hypertensive medications, they have weight loss surgery, their insulin requirement significantly decreases or goes away completely. Their hypertensive medications cut down in half or goes away completely. Their sleep apnea or the difficulty breathing goes away. So it has a profound effect on patients' health and lifestyle. Yes, we do happen to lose a lot of weight, but that's not the primary reason why we do the operation. We do the operation so that people can become more healthy.
Got you. I'm pretty sure there's research out there that states that after you do a certain procedure, you mentioned a couple of them, what percentage of those patients actually lose weight and actually get down to a kind of a goal weight, like if you do a procedure on them?
Sure. So the vast majority of patients, if they're compliant with their surgery and their postoperative dieting and postoperative exercise, lose a considerable amount of weight, and they keep it off. The statistics show that of the amount of weight that patients lose, on average, they regain between 5 and 10% of that weight. But if you're talking about losing 100 pounds and you only gain back 5 or 10 of those pounds, you're still very much a success story. So one of the misconceptions about being overweight and about being obese in this society is that everybody who's obese, they just need to put the fork down or they just eat too much.
Yep.
And there are many, many, many factors involved with why patients become obese, from genetic components, environmental factors, social factors. There's a lot of different reasons. Actually, the vast majority of patients who come to my office say the exact same thing, where they say, "Doc, I've been dieting and I don't eat and I try to lose weight, but I just can't do it." So I think there's still a stigma in our society about patients who are overweight, who are obese, and that they just eat too much, when in actuality, that's really not the case most of the time.
Gotcha. So you did 5 years of general surgery training, and then how long is a fellowship for bariatrics?
So the fellowship is 1 year.
Okay.
And unlike other surgical fellowships, you do not need to be boarded in bariatric or weight loss surgery. Now, I think it's just a matter of time before they come up with an exam that you have to take to become boarded in bariatric surgery. But bariatric surgery is such an extension of just plain old-fashioned general surgery that at this time, it's not felt that a board exam is needed.
Can you talk about some of the procedures that you do? I know you mentioned one or two of them. What are some of the surgeries that you do?
So the main two surgical procedures that are being done now for weight loss is something called a sleeve gastrectomy and the gastric bypass. The gastric bypass is the gold standard of weight loss surgery. We've been doing this for about 50 or maybe a little more years. Basically, you're rearranging your intestines and enabling you to lose a lot of weight. So you're rearranging the intestines so that you're not absorbing as much food, but you're also making your stomach significantly smaller so that you can't take in as much food. So we call this a malabsorptive and a restrictive operation. The sleeve gastrectomy we've been doing regularly for the past 10, 15 years, where instead of your stomach being essentially a bag, we make it a very skinny, narrow tube. So the reason why we've been doing this a lot more frequently is because we're showing that it's a lot less risky than a gastric bypass. And you also have almost the same amount of weight loss and almost the same amount of comorbidity resolution. So now, patients who come in with a BMI or a body mass index over 60, I tend to always go towards a gastric bypass. Or if they've been diabetic and on insulin for a significant amount of time, then I go bypass. But your typical patient is going to be with a BMI of 48 to 50. They're going to typically be younger, mostly female. These are patients who do very well with the sleeve gastrectomy.
And I can see how that can be life-changing and also very gratifying. You see these patients that have been dealing with weight problems for many years, and all of a sudden they come to see you, and you do something, a procedure, and it's life-changing. So
that's right. That's right. So there's another procedure that we do that's not surgical, where we put an intragastric balloon in your stomach, and what this does it expands or it takes up room inside your stomach, and it creates signals back to your brain that you're not hungry. So it decreases the amount of food that you eat, and it makes you more satisfied a lot sooner when you do eat. And so that's another procedure that we do, but it's non-surgical, and unfortunately, it's all out of pocket at this point. It's cash pay.
What is a typical day for you? It kind of starts at what time and ends at what time? How do your days usually look?
Dr. Webb, you know, as a surgeon yourself, it varies.
Yeah.
But typically, I get up every day at 5:30, and either I go start rounding or I have procedures first thing in the morning. It really depends. So some days I'll get home at 3 p.m. Other days I get home at 3 a.m. It really just depends. Actually, this morning I got called for, after we do this interview, I have to go to the hospital. I have an acute appendicitis. I have to do a laparoscopic appendectomy. So it's nonstop.
Gotcha. And did you take call a lot? How often are you on call?
So I'm in private practice, and we tend to take call quite often. I take call probably every 3 or 4 nights. Now, compared to residency, that's not a lot. You're out practicing, that's actually, you know, a good amount of call. And I operate at several different hospitals, so it's very busy.
Gotcha. So any advice that you would have for someone who's interested in the field of general surgery or bariatric surgery? What type of advice would you give those individuals?
If I had advice for a surgical resident or a medical student or a pre-med student about anything in medicine at all, I would say make sure never to close any doors. And by that, I mean always perform to your best, always put your best foot forward. You never know who's watching. You never know, someone that you meet today may be in a position to help you 10 years from now. You never know. Always keep your doors open, work hard. Also, you know, find that work-life balance. You have to take time for yourself. You have to care for yourself. If you don't care for yourself, you can't care for others. Specifically for those interested in surgery, read, study. This is what's going to take you far. So, you know, no matter how much research you've done, no matter who you know, no matter what recommendations you have, those scores on your MCATs, the scores on your board exams are going to be what opens doors for you.
Yeah, absolutely, and I agree with definitely with all those statements. You have some big things coming up. Can you tell us a little bit about kind of your future endeavors and?
Sure. So I've been an employed general and bariatric surgeon for the past 6 years in a private practice. I recently went back and got my MBA from NYU, and in doing so, this struck a nerve with me. This exposed my entrepreneurial spirit that I did not know about. And so I'm branching off and I'm starting my own practice. As of July 1st, I will open up my own practice here in Long Island, New York, in Huntington. It's called Clarity Surgical and Weight Loss Solutions. So it's very risky, but it's very exciting. I get to serve the community, serve patients the way that I like to, and I get to operate the way that I like to, and it's very exciting.
Yeah, congratulations on that endeavor.
Thank you.
That's really commendable.
Thank you.
You know, as someone who's going out into practice myself, I know can see how hard it can be to even get a contract or look for a job, but to open up your own practice, man, that's pretty awesome.
That's right.
And if anyone wanted to contact you or get in touch with you, how would they be able to do that?
Sure, you can always go to my landing page. It's www.claritysurgicalny.com. Or you can go to my Instagram page. My handle is Dr. Weight Loss Surgeon. I'm very accessible. I try to answer when I can, and I look forward to your comments.
Okay. And 3 last questions that I ask all my guests.
Sure.
You give a 1 or 2 word answer. What is your favorite thing to do outside of medicine?
Jazz. Listen to jazz. Yeah.
And your favorite food?
A medium rare plus ribeye.
Gotcha. Nice. And what is your favorite thing that you enjoy about bariatric surgery? You maybe already mentioned this.
Yeah, following the patients and seeing how life-changing the experience becomes for them.
Awesome. Well, Dr. Thompson, I appreciate you joining me today, man. You're a real inspiration to a lot of us out here, man. And I've never met a Black bariatric surgeon, so that's why I'm glad we linked up, and hopefully you can inspire someone that's out there that's watching to maybe go into the field or even see you as a patient, man. I want to say congrats on all your success.
Absolutely. And Dr. Webb, thank you for allowing me on your platform. You have an expansive platform that reaches thousands of viewers, and you yourself are an inspiration to all of us. So thank you.
Appreciate it, man.
All right.
Thank you for watching this video. Make sure you subscribe. New videos coming every week. We'll see you next time.